Parliament of Calgary, Mountain View.
Thank you, Mr. Speaker. Well, there appears to be a credibility gap between what the minister is saying and what the experience of the folks suffering with this. The abrupt removal of fertility treatments from the Lois Whole Hospital for Women in Edmonton has come as a devastating blow for hundreds, and I don't see it as likely to improve access and improve wait times. Today, a rally at the steps highlighted many of those affected, and they're in the gallery today. Thousands more signed formal and online petitions, which I'll table shortly. To the minister, will you reverse this decision, yes or no?
Honourable Minister.
Thank you again, Mr. Speaker. Two physicians at the clinic that have been providing uninsured services have chosen to move their practice to a different clinic. I can't force them to reverse that decision, Mr. Speaker. It was the decision that was made. They're continuing to provide the services in the city of Edmonton, and I have made very clear to AHS that we want to ensure that any transition is done with ease to the patients and to their families, but that all insured services continue to be provided there, and we actually believe that AHS believes that they'll be able to reduce the wait times and provide more of the insured services with that space, Mr.
For supplemental.
Mr. Speaker, we'll take that as a no. Since 2015, Alberta Liberals have campaigned on a promise to provide public funding for costly fertility treatments, which would save patients money and save the health system money. No other party has made the promise, choosing instead to send couples to private clinics whose prices are much higher than those of the Lois Whole. Today I want to give this government an opportunity to change that. Will your government commit to funding at least the first round of expensive IVF treatments, saving both patient costs and the system costs?
Honourable Minister.
Thank you, Mr. Speaker. And again, I look forward to an opportunity to meet with some of the folks who have been involved in organizing this, as I have a desire to meet with them and have reached out and look forward to discussing this more. Again, I know how difficult challenges with fertility can be on Albertans. And Mr. Speaker, one of the things is that we're working very diligently to protect and strengthen our public health care system. We know members opposite are calling for deep and brutal cuts. We're not going to do that. We're working with Alberta families. I don't want to make commitments that I won't be able to follow through on, Mr. Speaker, but I certainly look forward and am open to opportunities that we might be able to.
Honourable Minister, second supplemental.
Well, the other important impact here is a loss of academic training programs and opportunities. This clinic is one of only 2 academic IVF centres in Canada. More IVF specialists have been trained at the University of Alberta in the last 10 years than any other university in Canada. Now AHS has encouraged successful doctors to leave the public system for the private system. What is the government's plan to train the next generation of fertility specialists who have been forced into the private system?
Honourable Minister.
Again, Mr. Speaker, I want to clarify that AHS has informed me that the physicians made a decision to move to a different practice. Mr. Speaker, that is a decision that I think we need to respect. We certainly want to ensure that all of the publicly delivered services continue to be offered in the hospital, and that's our intention. And we respect the decisions that others have made to move their practice, Mr. Speaker. But we are going to make sure that everything that is publicly delivered, we're fighting to protect, strengthen, and improve. I know the members opposite are yelling at me to move privatization models, Mr. Speaker, but we're not going to do that. We're going to keep fighting for the publicly insured services to continue to be publicly insured, Mr.
Thank you, Honourable Minister. Carson Taber.